I think we're gonna get started, make sure I give enough time. So I'm excited to introduce Dr. Brooke Anderson for our epidemiology series, seminar series. Um, Brooke is an associate professor at Colorado State University in the Department of Environmental and Radiological Health Sciences. She's a member of the university's Partnership of Air Quality, Climate, and Health, and serves on editorial boards of Epidemiology and Environmental Health Perspectives. She completed her Ph.D. in engineering at Yale and her postdoc in biostatistics at Johns Hopkins Bloomberg School of Public Health. Her research focuses on the health risks associated with climate-related exposures. And her talk today is about measuring the mortality impacts of climate-related disasters. Brooke, please take it away. Thank you.
Oh, thanks so much. Is that clear? Are you all able to see that?
We are seeing your full screen rather than just the image of the slide, but
Ah. All right. Let me try one more time. Is it the same case now?
yeah.
All right, let me try opening up a different one. How about now? Okay,
That looks great.
Perfect.
let me just get back to the beginning then.
Yeah.
How many years in and I finally figured out Zoom?
I know.
All right. It is a real pleasure to be here and to join you all today. I was really excited to hear that I think a common theme has been disasters in the work that you've been doing in your seminars this year. And that's an area that I find very interesting. And one thing that I found is when I go across the literature and I look at papers from different areas, sometimes you see estimates that are pretty different in terms of estimating the mortality impacts. And there's some good reasons for that. And I think there are different approaches that are complementary, but it's really critical to understand the differences and the reasons for doing the different approaches. So that's something that I want to talk some about today, this general question of how we measure the mortality impacts of climate-related disasters and how in practice people are actually doing some different methods that are complementary, but sometimes mean that we have estimates that are a little bit different. To start, I want to talk about a question that I think every epidemiologist grapples with some, which is ideal information versus the information that you actually get. I have started working some with laboratory-based scientists, and it's always a thrill there because we start talking about our question and they ask me, well, how do you want to design the experiment? And so much of my work is observational. They say we can design the experiment. Often we're getting a lot of really good information in epidemiology, but it's not the perfect information. And so part of what we do is figure out how to gain the most insight from the information we can get. So let me start with talking about an example of that I think is really intriguing. This idea of not having perfect information, but being able to make the best of the information you have. And then we'll get into talking more about natural disasters. So this is an example that comes from World War II, a famous statistician called Abraham Wald, who was working at Columbia at the time. What he was trying to help with was bomber planes were very important during that war, and they would send them out, and it was an important part of the campaign, but they weren't perfectly built and some of them would not come back. So they were very concerned with figuring out what made some of the planes vulnerable and trying to fix that. Now, in an ideal world, when you send all of these planes out, you would get information about every single plane that you got out. If you were trying to figure out what made it more likely that some planes made it back than other planes, you would want information on every single plane that went out, and then you could compare the ones that went down with the ones that did not. Of course, that's not the kind of information that you actually had. The planes that were going down over enemy territory. Sometimes you might get them back, but usually those were lost and you had no information about them. What you got instead was just the portion of the planes that, if they were hit, were still able to make it back to the base. So they thought through about how they could use the information they actually had rather than the information that would be ideal. This is just a sketch of the idea. We'll see the actual data looked a little bit different in just a second, but this is the idea that Abraham Wald came up with. He said, well, we can take the information that we get, and then we can work with some of the assumptions that we have to use that to try to answer the question we have. So what they did is they created a diagram of the planes, and every time a plane came back, they would count where there were holes, and they would put those on this diagram. And this was the idea they were starting with when they were laying it out in the first place. But their idea was the way that these planes are being shot at is not very precise. It should be pretty random where the bullet holes fall spatially across the plane. If we see that planes are coming back and there are certain areas of the plane where there are no bullet holes, those are likely very vulnerable areas, and it means that if they were shot there, they couldn't make it back to the base. So those are the places that we want to shore up and make stronger. This is the actual image from the war report of what he was doing. You can see here he started with the basic diagram of the plane, and this, once they did that, is the kind of information that they got. They were seeing bullet holes everywhere in the planes except for 2 areas. And so from that information, they were able to figure out places to reinforce. Another famous character in a war in the history of military combat was the Duke of Wellington, and he had the same idea that I think is really nicely captured in this quote. He said, all the business of war, and indeed all the business of life, is to endeavor to find out what you don't know by what you do. That's what I call guess what was at the other side of the hill. In the case of epidemiology, especially when we're working with observational data, we often don't have all of the information that we need. And so we really need to think about how we can use the information we do have to be able to come up with the greatest insights. So let's talk next a little bit about epidemiology and disasters. And I want to make sure, I imagine you have covered a lot of this in your seminar series this semester. I want to make sure I'm placing what I'm talking about in a full cycle that includes a lot more other elements. I think that this diagram is very helpful to think about the ways that epidemiology comes into play when there is a disaster. So I'll start down here. When a disaster hits, some of the most immediate purposes of epidemiology are to make sure that you can limit the impacts of that particular disaster, that you can help the safety of the people who are involved in that particular disaster. So often the first role of epidemiology is to figure out what are the rapid needs. Are there infectious diseases that are spreading through shelters? In that case, that might be something to take care of. Are there problems with insect infestation or people getting animal bites? These are all things that, if you know it very quickly, there might be things that can be done to try to prevent the impacts of that particular disaster. Now, as you move into later stages, there might be things that can be done through tracking systems and through health surveillance to continue to help the people who were affected by that particular disaster. But at a certain point, we're moving more into an area where we are using the information from that particular disaster to help us figure out how to better prepare for future disasters. This is where we might get into deeper epidemiological investigations, and particularly ones that are combining information from a lot of disasters. A lot of what I'm going to talk about today might have facets from different parts of this, but I'm really going to be focusing on this part of the epidemiology of disasters, where we're taking information from past events and trying to use that to better prepare for future events. Next, I wanted to make sure that we're all on board by what I talk about when I'm saying a mortality impact. So what we'll be talking about are the number of deaths that happened that would not have happened without the disaster. So following a disaster, we're specifically interested in determining the number of deaths that occurred in that area that was affected by the disaster during the time period of the disaster that would not have occurred but for the disaster. And I've put in an image from a flowchart here that I think is helpful in kind of capturing this idea. So this is a flowchart made for people who are going through and trying to assess the impacts. And one of the specific questions that we're asking is, if this disaster had not occurred, would the decedent still be alive? Now, as I go through and talk about some of the things today, I've got an image that will be a recurring image. So let me take a minute to explain how we're going to look at this and interpret this. I'm going to be talking about the number of deaths that happened during a disaster period in the location of the disaster. And we're going to be thinking about the number of deaths in that location and in that time period. And I'm trying to visualize that right here. So each of these squares, I want you to imagine as a death. I've put numbers here on the left-hand side, and as we go from the bottom, this is a running count of the number of squares. When I'm showing this as a square, we'll imagine that we can figure out for that square who the person was who died, and we can probably get some information about that particular death. So when we think through and ask that question about the deaths that occurred that would not have occurred without the disaster, we're moving into an area where we're going to start thinking about different scenarios. We're going to think about what actually happened, and then we're going to think about a counterfactual, what might have happened but didn't. This is from a forecast, and it was at a point when they were actually tracking the storm, but I think it's a really nice image of the idea of a counterfactual here. We're going to be thinking about the scenario of a storm coming and hitting a location, but we'll also think about that alternative. What would have happened if we were in the same period, in the same location, otherwise under all the same circumstances, but with some small shift in the weather pattern, the storm instead had a near miss and we were not affected by the disaster. So if we take that scenario and we have this question of how many deaths occurred and what the nature of those were during the disaster that would not have happened without the disaster, what would our ideal information be? I think it would look kind of like this. We would have the reality that the storm hits, and we would have information about every single death that happens under that scenario. In the United States and many other countries, a lot of times we can get this information pretty well. We might not get it perfectly, but we can often get it pretty well. The other piece of information that we would need to have is the counterfactual. What would have happened if there had been a different truth, a different scenario that came through? If the storm had instead missed, what would it look like in terms of the numbers of deaths and the character of each of those deaths? This is the information that we don't have, and so part of what we'll be thinking about here is how we take what we do have and make the best of it to gain insight. If we had this perfect information, here's a way that we could look at the data itself. There would be a certain number of deaths that would occur regardless of whether or not the storm had happened. I've shown those in gray here. There will also be some deaths that would happen only with the storm. Those might be things like somebody is in their home and a tree falls on the home and they're crushed. It might be something like there are floodwaters and the person drowns in the floodwaters. It could also be things like somebody is cleaning up after the storm and they're electrocuted, or their power goes out and they use a generator but do it in a way that's not safe and they die of carbon monoxide poisoning. It could also even be from something like the stress of the storm causes a heart attack. The ones that I've shown in blue here are deaths that would have happened only with the storm. And it's interesting to think about, but I think it is the case that there are probably also in the counterfactual some deaths that would have happened without the storm that might be avoided when the storm comes through. And I've shown those in green here. Those might be from things like if somebody had a planned surgery that was dangerous and that gets canceled because of the storm, or it might be because people stay at home because of the storm and so there are fewer automobile accidents. Under an ideal scenario, we would have all of this information about both of the scenarios, and we would also have detailed information where we could go through and do some of the assessment of deaths that were happening during the storm and potentially deaths that were avoided. However, we do not have that information. Going back, we are having to guess to some extent about the other side of the hill to be able to make some of these assessments. In the world of disaster epidemiology, there are two large ways that this is being done right now, and sometimes they give different numbers. I think both of them have value, and we're going to talk some about both how we do it, how they compare to each other, and what the values are from the different ones. Because I think as you move into the world, I know many of you are doctoral students, as you move into the world where you are going to be the professionals and the experts in this, it's really important that you be able to critically assess these kinds of studies that are coming up and compare and be able to answer some of the questions about why some of these numbers look different sometimes across different studies. So the two things that we're going to look at, I am calling here, first, counting cases, and second, estimating the excess. So let's get in and let's talk about those two alternatives. We'll start by counting cases because I think for many people, this is the first thing they think about in terms of how you might answer this question. All right, when you move into counting cases, that is a case where you take information about every death that happened during the disaster period in the disaster location, and you look through the record of what happened for that death to try to say, I think this death was caused by the storm. I think possibly it was caused by the storm, or I think it wasn't caused by the storm. So this is a case where for each of these squares, you would go and look at the death certificate. You might talk to the coroner, you might talk to the family, you might gather other information and say for one of these red squares that is a linked death, maybe that is one where a tree fell on the house and you were very clear that that was a case that would not have happened without the storm. Maybe one of these gray squares is somebody who was in hospice, who was already very clearly very ill, and you're pretty sure that the disaster did not contribute. Now, often when this is done, you can even go through and you might mark these as direct deaths versus indirect deaths. A common definition for this is that a direct death is something that's caused by the environmental forces of the hurricane and the direct consequences of those forces. These would be examples of the winds causing a tree to fall over and that falling on a house and crushing someone. It would be an example of somebody who drowns in floodwaters. The other kind of death is an indirect death. These are caused by unsafe or unhealthy conditions because of a loss or disruption of the usual services, personal loss, or lifestyle disruption. This might be an example that the power goes out, somebody uses a generator, and then they die of carbon monoxide poisoning. So once you go through and do this, one of the advantages of this method is you have very detailed information about each of the deaths that happen. So you can take those deaths that you have linked with the disaster and you can divide them in between things like direct and indirect. You might even divide them into ones that are pretty clearly linked to the disaster and ones that are possibly linked, but you're not sure. You can really get in and have a very granular level of information for each event. In the United States, a lot of times this research on disaster is done by the CDC, and a lot of times it's reported through something called the Morbidity and Mortality Weekly Report. I imagine at some point in your classes you have come across this or some information on it. I'm giving an example here of one of them. This is from the first report of what we now call AIDS, but a lot of the first ground level research in the US is done by the CDC, and that is particularly the case in disasters. So we'll look at that for one particular storm. This is Hurricane Floyd in 1999. This hit Eastern North Carolina. I was starting college at the time, and my home is just over the border in Virginia. So this was literally close to home to me and an event that I have a lot of interest in. One of the particular issues with this was not so much the winds, but in that part of North Carolina, it's fairly flat. There's a lot of drainage from rivers, and so there were terrible cases of flooding. By May of 2000, the CDC had published a report on this event, which happened in the fall of 1999. This is the kind of information that they were able to get out and study based on this kind of counting cases approach. So you can see here that they were able to identify 52 deaths that were linked to the storm, and they were able to get very granular information about the full story of each of those deaths. You can see they've divided it into information like whether it was drowning, whether it was an automobile accident, a myocardial infarction or heart attack. fire, hypothermia, fall, electrocution. And then in some cases, they were able to get into details about the exact history of how that drowning happened. They're also able to get into very granular details about the people who died during the event. So they're able to determine things like the ages of each of the descendants and whether they were male or female. This is all information that can be very helpful, not just in understanding the impact of the storm, but also being able to prepare for the types of circumstances that might increase the risk of death in future storms, and to warn about that and to think about ways that you can try to avoid that in the future. This is another example. This comes from Hurricane Katrina in 2005. This was published in 2006. So again, you're able to see that these kinds of studies are coming out fairly quickly after the event. In this case, not only do they have specific causes of death, but they've divided into direct, indirect, and possible. And again, you can see there's a very granular level in terms of the story of each event that was happening, each death that was happening. All right, next let's talk about this idea of estimating excess mortality as an alternative approach for trying to answer that question of how many deaths happened during the storm or other disaster that would not have happened without it. All right, as we move into this, we are taking away the boxes. You can see that there's no division right now. Instead, we're going to focus on the number across the community as a whole, the number of deaths across the location during the time period as a whole. And we're no longer going to think about granular information for each of the specific deaths that happens then. So in this case, the information that we have in reality, that again, we often have a very good measure of, is the number of deaths that happened across that full community during that period. Our counterfactual is the number of deaths that happened without that particular event. In this case, our excess is just going to be the difference between those two. Now, the area where we don't have the information here, where we're going to have to use some of our tools to try to make a good estimate, is with the counterfactual. How many deaths would we have expected in that community if the storm had missed, rather than the factual event that it actually hit? We'll go through a few examples of doing it, and there are a number of different ways of estimating that counterfactual or bringing that information in, and some of them, it turns out, are actually quite simple and straightforward. So this is an example from COVID. This was actually an analysis done by the Financial Times. They were using as a baseline, as an estimate of what we might have expected during the period of COVID if it weren't for COVID. They used the numbers of deaths in recent years. So each of these light gray lines are showing that, and they've taken an average of that historical period that's shown in the darker line. Then they compared what actually happened in 2020 to that event, and they're taking the difference of those two as an estimate of the excess. You can see here that being applied in a number of different communities, and in all cases, it's a pretty substantial excess. Later, we will look at how this compares to another method that's closer to counting cases for that, where you would take the actual, whether the person had tested positive for COVID, whether there were circumstances that suggested it was COVID. And the idea here is that a number of these deaths were from COVID itself, but there are also likely some deaths that were more indirectly related. Things that might have been related to the fact that people had a harder time accessing medical services, or people were under an extreme amount of stress, or other things related to COVID, but not from the virus itself. Here's another example of this approach, and this is from a 1995 extreme heat wave in Chicago. For right now, we'll just focus on the bottom part of this, and we'll come back to it later. But during that event, the green here is showing the daily temperatures. And there was a period in mid-July where they became extreme. This blue is showing the period of the heat wave. There were noticeable increases in the number of deaths during that particular event. Here, they're estimating the excess by taking this orange line, which is the average over the decade surrounding the event of the number of daily deaths. And then they're comparing it to 1995 itself and taking the difference between these two lines as an estimate of the excess. Here's another example using a similar approach. This is done by the New York Times. Again, I want to emphasize that sometimes these excesses are so large for the disaster that we can often get a fairly good ballpark with fairly simple statistical methods. This is using the 2 previous years, and then it's showing Hurricane Maria's landfall and showing the number of deaths during September and October from that. And later we'll look at how that sums up as a total number. This is the final example I wanted to show of this. This is from Dr. Mei-Lin Yan, who did this study as part of her doctoral dissertation here at CSU. She did a study of an extreme flood in 2012 in Beijing. In her case, she used the mortality rates during the actual event, and then to be able to have that counterfactual, to be able to bring in that estimate of what would have happened without the event, she used something that involved a little bit more of a statistical model. So it was used days that were seasonally matched non-flood days in previous years, but also used some control for potential confounders, things like temperature and air pollution that might have been different during the 2 events, might have been related to the exposure that we care about, and helped in getting a better estimate to compare that idea of a counterfactual versus what actually happened. All right, now we'll move on to talking about how we compare the measurements from the 2 methods, and then I'll wrap up by talking some about what I think are the advantages and disadvantages of each method and how we kind of take the information from both of them and use it synergistically rather than being confused that we're getting different numbers. Let's start with the 1995 Chicago heat wave, and this time we'll look at this information up at the top. So they have numbers here for the numbers of deaths based on that more counting cases kind of approach. So these are cases where they found that on the death certificates, it was mentioned as heat related. In that case, there were 465 deaths that were found to be heat related associated with the heat wave. By comparison, if we do this excess deaths approach, we're finding there were about 700 more deaths during that period in that location than we would have expected without the disaster. This next example is showing a similar analysis from COVID. So if you look at the dark blue bars here, each of those is for a date, and each of those is a confirmed death where COVID-19 was the cause of the death. The light blue are ones where they determined that COVID-19, the virus itself, was the probable cause of the death, even though they didn't have enough to confirm it. The black line in this case is the estimated number of all-cause excess deaths. Again, you can see that this is tending to capture a higher number of deaths that likely would not have happened without the event than these cases, the estimates when we look through and we're trying to attribute each case to the event. Here are the results from the Beijing flood study. In this case, they found that there were 34 deaths if you use more of a traditional surveillance approach, but using the method of estimating excess deaths, a more statistical approach, we identified that there were 79 excess deaths, so about twice as many. Here is a study that looked at this question during the 2004 Florida hurricane season. This was a very extreme hurricane season in Florida. They had 4 major storms, Charlie, Ivan, and Francis and Jean. Francis and Jean happened so close together that they couldn't really separate the estimates. So those have been put together. The second line here in the green box that I've put, these are the numbers that were the official death count based on that more case counting type of approach. The top is based on estimating the excess. Again, you can see all of the numbers are at least twice what the official death count was when we look instead and try to compare the number of deaths that happened during the period versus what we would have expected if the event had not occurred. So again, we're seeing this continuing pattern that the estimating excess tends to lead to an estimate of higher impact in terms of mortality. Here are the estimates from Hurricane Maria. Hurricane Maria hit on September 20th. You can see down here the change in the official death toll through the end of October. By the end of October, there were fewer than 100 deaths in the official death toll. By contrast, the line at the top is showing the difference between the number of deaths in 2017 compared with previous years, using those previous years as an estimate of what might have been reasonable or what might have occurred without the disaster. And you can see under that method, by the end of October, there were over 1,000 deaths. So this is a tenfold difference between the estimates with the two approaches. If you find this topic interesting and you are thinking you'll move into disaster epidemiology, I would strongly recommend that you look at this commentary in Nature called Death Counters from 2019. One of the things that is happening with this is not just that it is important scientifically for us to answer these questions, but sometimes it becomes a very big political question as well. And sometimes there's a lot of pressure and a lot of questions in terms of what estimates are correct. This article is a very interesting article written for scientists that talks through some of these issues. As part of the article, it says, normally mortality counts are the function of governments, which collect death certificates and keep the public informed. A death toll should theoretically be as straightforward as tallying those who perish. Nothing about disasters, however, is simple. So now let's take a moment and talk about how these serve as complementary approaches. So when we talk about estimating the excess, one of the big strengths of this approach is that we are trying to estimate that number that we said we want to have, the number of deaths that would not have occurred but for the storm. We're estimating that with the least amount of bias. We're estimating it with the lowest amount of error. This method is really trying to capture that idea of numbers of deaths that happened during the storm that we don't think would have happened without the storm. There are some compromises to it, though. First of all, the number of excess deaths, it's estimated with some uncertainty. We never have an exact number. Instead, we have a number and then some range around it. That's because we don't know exactly how many would have happened if the storm had not happened. And that's introducing some variance in our number. The second big downside is that the individual deaths are not identified as linked or unlinked. We might know that there were 10 or 100 or 1,000 more deaths during that period than we would have expected if the storm had not hit. But we can't go through and say which of the deaths that occurred during the period we think were the ones that wouldn't have happened. And that means we can't go through and get as much information about the circumstances around them or the mechanism for how they're happening. On the other hand, when we look at counting cases, one of the big strengths here is that we are maximizing the sensitivity. This tends to be a method where we have a lot of confidence for any of the deaths that we linked that it in fact would not have happened without the disaster. The compromise, though, is when we maximize that sensitivity, it's decreasing the specificity. There are a number of the deaths that we might not have been able to identify as being linked based on this kind of case counting approach that in fact would not have happened without the event. That's leading to the case where often the numbers that we get from this kind of approach tend to be a lot lower than the numbers that we estimate when we use the excess mortality kind of approach. There's some other things that come in as implications of this. So when we think about estimating the number of excess, we are having to try to come up with some estimate of what we would have expected under the counterfactual, what we would have expected if the storm had not hit or the disaster had not occurred. Because of that, we're prone to some issues that come about with asking that statistical question. And one of them is that we sometimes run into issues with statistical power. If we are looking in a case where the number of baseline deaths are pretty high, then we can probably get a pretty good estimate of it. If we're looking at a case where we're looking at an area that doesn't have a lot of deaths from day to day or specific types of deaths that are not that common, we'll often have the case where we might not be able to estimate it with a lot of certainty. We might have very wide confidence intervals on our estimate. This is showing Chicago for 1995, and they looked through at different causes of mortality in that. For total deaths, that's something that is happening fairly frequently each day. And so those are the kinds of areas where you can estimate with a lot of statistical power. As you move into more specific causes, things like excess heat deaths, For most days, those are pretty low. So it is hard to estimate what the number would be if the event had not occurred. Now, in the case of excessive heat deaths, there were so many of those during the event. It was so unusual. You can probably get a pretty good estimate. But there are some other types of deaths that might be linked, but where it might be very hard to get a lot of statistical power in doing that estimate. This comes into play when we look at locations as well. Here, this is showing estimates across Puerto Rico as Maria crossed, and you can start to see some of the geographical patterns in that excess mortality. However, as you start to do this, any area that is less densely populated, any area that's more rural, it might be harder to get good estimates of this because you're having to do that estimate of the baseline with information that you don't have because it's a counterfactual that didn't happen. You don't have that same issue with the counting cases. So even though you're likely going to be underestimating the number, you have a lot more detail about it and a lot more confidence that each case that you identified was in fact linked to it. And really, there's a high amount of value in the amount of dense and granular information that you get by looking through each case and looking through the history of what happened. You can see here, this is showing for Irma in 2017. You can see the amount of information that they were able to gather about each of the cases that they identified was linked to the event. And they were able to look even at very specific questions with that. So one thing that happened during Hurricane Irma is that it caused power outages. It got very hot. This was Florida. It got very hot right after that. And there were a number of cases where people, especially in nursing homes, didn't have air conditioning and were dying from heat-related causes. So through this kind of approach where you look at the cases and you look at the full history of each case, they were able to identify the split of deaths that were related specifically to power outages, deaths that were related to existing medical conditions, and then ones where those two factors were overlapping. So there's a lot more that can be determined about the mechanism and the pathways for how certain deaths during the event are occurring when you look in detail at each of the cases. All right, so I'm going to wrap up with that, and we'll have a lot of time with questions. But I did want to come back and just emphasize again that I think one of the take-home messages of this whole thing is that nothing about disasters is simple. It's very important, especially in a changing climate, that we have a better idea of some of these impacts, that we have a better idea of how we could try to reduce some of these impacts. Unfortunately, it's not simple to do that because we don't have all of the data we would want to if we had a controlled experiment. But that is also part of what makes epidemiology interesting, is that we need to figure out how to do that. All right, I'll end there and happy to take questions.
Thank you very much. I'm going to open it up for questions from the audience. You could do it in a variety of ways. You can raise your hand, you can yell out, you can put it in the chat, whatever you're most comfortable with. I can start off if I guess I have sort of a bigger question. Thank you for this. This is very sort of thoughtful and thought-provoking. I'm curious as to how you're thinking of sort of how the current federal landscape and sort of potential changes to FEMA and all the other sort of changes, but may impact our ability to collect sort of this type of data in such detail, and assuming that I may know your answer, the follow-up question being, or assuming I know the direction of your answer, not the details, but the direction, follow-up being like, how can we still, do as good a job as we can?
A very sobering question indeed, and maybe an unfortunate one. Yeah, I think you're absolutely right. There are a number of ways that will affect it. So, you could see going through this that a lot of those immediate studies are run by the CDC, and that requires a really good infrastructure and a really good system and really good people working at the CDC to be able to go out and do it. That has classically been a way that we have kind of that first level of response from an epidemiological perspective in this country. So that is one area where we need those resources, and hopefully this won't disturb that too much, but it looks like a lot of is being disturbed. The other area, though, that I think is maybe a touch less obvious is that for doing these estimates of the excess mortality, you need historical data too, right? It's not just what happened during the event. You need stuff for the years before the event so you can do a good estimate of what happened during the event. A lot of environmental epidemiology, where we're looking at the effects of air pollution, where we're looking at the effects of temperature, where we're looking at the effects of a lot of these ambient types of exposures, we've got to have historical data. We've got to have a lot of it. We've got to have it in terms of the exposure and in terms of the outcome. And we've got to have it for a lot of years in a lot of places to get the statistical power to really answer the question correctly. So I think that's one area that it's a little bit scary is I mean, I don't think it's just that we're losing good people. There's some data sets that have been pulled down. And I think there have been people, maybe somebody else can comment on this too. I think there have been some groups that have been rushing to try to archive that and still have it available, even if it's not through a federal website. But that kind of data, having that data available, having it accessible, having it in a way that it's fairly easy to pull and work with and understand what's in it, that's critical for a lot of environmental epidemiology.
Thank you, Alan. I see your real hand, which is very,
So analog.
yeah, that's what I'm looking for.
It was a really nice talk. Thank you. And your point about data collection is so good. I'm wondering, you talked about the granularity of the information when counting cases, and the excess mortality giving you this other estimate. And I'm wondering about ways to kind of hunt in the heterogeneity, even in the excess mortality situation.
Yeah.
So
Yeah.
you know, you don't have, you might have lots of information about the individuals who are counted as deaths, right? Is there value in trying to model that in the counterfactual, right? Like, so
It's
yeah.
an excellent question. And it comes down to statistical power, honestly. So when you're doing that estimated excess, you can break it down and look within categories, right? You could try to do it for people who are 65 and older to try to get an idea of people of risk in older adults. You could do it for children. You could do it for males and do it for females and try to get some estimates there. So you certainly can do that. That's done some with disaster events. It's done even more in things looking at exposures that happen from day to day, like air pollution, like temperature. You'll see a lot of estimates there. The part where you run into limitations is that as you get into finer and finer categories of that, you have fewer and fewer events per day under a baseline scenario. And that brings down the statistical power to make your estimate. And so you end up where you might be able to do an estimate just for males under 1 year of age, but it might be with a confidence interval that's massive. You start to have a lot of the variation in your estimate of kind of like the baseline, the counterfactual. That starts to become really, really large as you get into a more granular category where your baseline is lower. I see a hand for Will. Am I allowed to call on people? Okay.
Hello, thank you for the talk. I found it super interesting. I'm thinking about disasters, particularly a lot of your examples were on hurricanes, and that many of the areas where we're trying to estimate excess deaths have hurricane seasons, obviously, every year.
Yeah.
And so, what is your thought on new ways that we might estimate that counterfactual when the baseline of what normal mortality is might be shifting very rapidly as our, particularly around something like hurricanes are intensifying and becoming more frequent?
Yeah.
Is 5 years ago's worth of data still a good estimate of what might have happened when you've now had a
Excellent question.
completely sort of freak hurricane season,
Yes.
or what
And
feels freakish for us, but
not
will
just
become
is
normal?
5 years enough, but was there
Yeah.
another hurricane in those 5 years? Yeah.
Yeah.
It's a really good question. So there are kind of two aspects to it. So I'll do each of them. So first of all, with doing the estimated excess approach, one of the advantages to that is that it scales. You can start to move your model. So you're not just looking at one event, you're looking at every event over the last 20 years in Florida. And then as you build your model, you're doing an exposure for when you were in part of a storm and when you were outside of a storm. Mei-Lin Yan, who I mentioned, has a wonderful paper that goes into some of that was published several years ago. I've done a lot of work where I was working on the exposure assessment, and Robbie Parks out of Columbia was leading some of the epidemiology. And we've got some great studies out of that where we're looking at long periods of time, lots of storms, lots of locations, and we're starting to see patterns. We've mostly done that based on exposed or unexposed, but we're moving into some stuff where it's looking not just at exposed, but how extreme were the winds? Are we seeing an exposure response pattern where we see things that are different? So there are certainly ways to scale, particularly that like kind of excess mortality approach to try to answer those questions. Now, the other thing that happens that becomes very, very tricky is sometimes these storms are so extreme that they change everything and make it really hard to do estimates. One example is after Hurricane Maria, a lot of people left Puerto Rico and never came back. After Hurricane Katrina, there were people who evacuated, who made their homes somewhere else and never came back. So sometimes you're getting cases where it's changing the whole demographics of the area. And that does create some additional complications and adds to the uncertainty when you estimate it. I think that's an area of kind of like continuing thought for exactly how to address that piece of it methodologically.
Thank you.
Mhm.
Other questions? Don't be shy.
I think Ellen, yeah,
Can I ask another one?
absolutely.
So one of the nice things that I like about the accounting is that some of your work has leveraged the National Center for Health Statistics, right? And so that they have county of residence, not just county where an event occurred, right? Because you have all this displacement. So during the January wildfires, right, the MMWR said that emergency department visits went down 9% in LA because they told everyone to evacuate, right?
Yes,
So
right,
that makes
right.
sense. And you're able to count people, you know, who you're counting them by where they were expected to have resided, right? So you sort of have this, because you have this long-term residence, you have sort of this counterfactual location, right? Even though, and you're able to lag things in time, so you're able to kind of accommodate some temporal displacement in the direction that makes sense. But I'm wondering, have you ever done anything with the fact that some people, so you would anticipate at any given time, some people would die in their county of residence, and some people who die will not be in their county of residence, but you would anticipate that that relationship could also change.
Yeah, no, this is a very excellent question. Y'all are definitely getting into all the subtleties of the things that keep me up at night. Yeah, so a lot of times also with the estimating the excess, a lot of times the data that we're getting from that is also based on vital statistics, and we can tie it to where the person resided. So when we're getting the total number, it's not necessarily the number that were in that location at that point in time, it's the number of people who resided in that location in that time period who might have been out of town, who might have been evacuated. So we're kind of like comparing a similar population usually, I think, between the two cases. Although counting cases, we would probably capture some people that we could note as such that resided somewhere else, but were in the area. Now, the difference is when we're doing estimated excess, we might know that they resided there. If the number's going up, there could be some people where they died during evacuation, and it was attributed to the fact of something with evacuation, an automobile accident as they were evacuating, you know, a disease or stress or lack of medication in the location where they were sheltering. But with that method, we don't even know how many of that excess were people who the death was in place or the death was as part of the evacuation. Whereas for the counting cases where you have granular information, that's pieces where you can go through. And again, you can have that story and you can have the pathways and you can have a guess at the mechanism. So yes, I think you're right about that, but it is not the case typically with the nature of the data that's used for estimating the excess that you miss people that evacuated.
Yeah, I'm just wondering, can you do a decomposition to sort of get at the role of evacuation?
You
I mean,
mean
we're
to do
always
the counting
seeking
cases ones, or
solutions.
I mean, one area where I know I haven't done any of this, but I know there's some people that are interested in it. There are ways to try to track how many people were evacuating through using things like cell phone data and other things like that. So there might be some clever ways to try to pair that up. But yeah, the counting cases would be where you could go through and get that full information. And for estimating the excess, you don't really know for each of those numbers going in where they were when they died, because again, you have the total numbers that you're comparing rather than knowing which of the excess deaths were ones that were in that excess part of it versus ones that were in the baseline part of it.
Another question that's come up is about so our dean Ashish Jha wrote this piece into the Boston Globe where he said in response to hurricanes, the healthcare system could respond by sort of relaxing rules about healthcare out of state, right? That you should be able to treat people. And so I'm wondering, be able to give prescriptions in other states, get access
right.
to care. And I'm
Yeah.
wondering, have you ever done anything with discontinuities at state boundaries? Like, well, I mean, again,
No,
this
I'm trying to think if I
almost
know
like
of
a counting
anybody.
cases thing. But
Yeah. That's a really interesting idea for a study. I don't know of any stuff that has done that. There certainly have been some studies that were more on the ground kinds of studies, checking in with things that were happening in shelters where people had evacuated. And there certainly are a lot of cases that people did not have a lot of medication that they were taking with them. In some cases, very critical medication. I mean, there are cases with I think this operates under a different insurance system, but dialysis, right? Being able to continue to receive dialysis care becomes more difficult. So there are a number of things like that that could come into play. I think my one hesitation, I think it's a really interesting idea for a study. I don't know if the statistical power would always be there to do it. Again, where you have one-off disasters, it can be tricky. But moving into trying to do things where you are looking at larger sets of disasters, and part of the work that I have done in the past is putting together exposure data sets that are at the county level. So they're pretty easy to pair up for some of these spatial, social, political kinds of questions like healthcare coverage as you cross state lines. And those are ones where we've tried to measure in the same way exposure to tropical cyclones for the eastern half of the United States over many, many years.
I think we have time for one more question. I don't know if any of our, I'm going to call it our doctoral students, if any of our students have any questions for Dr. Anderson. Okay, I don't mind awkward silences, but I think that one got long enough. Thank you. Well, I think unless anyone has any final burning questions, I just want to thank you for joining us. Hopefully next time you can come in person and visit us in Providence. But we appreciate your flexibility, and we were excited to have you join us virtually and hear about a lot of your interesting work and how you're thinking about these things. So thank you for sharing.
Yeah, thanks for having me in.
All right, take care. Thank you everyone for joining.